Welcome to Beyond the Smile. I'm your host, Dr. Layla Haishaw, founder and CEO of the nonprofit Diversity in Dentistry Mentorships Incorporated. In this podcast, Our Huddle, we bring together successful dentists of color to encourage, empower, and educate our mentees to be competitive candidates to successfully get in, get through, and thrive beyond dental school. Are you ready to be inspired into action? Then you're in the right place. Let's huddle up. The inaugural season of the Beyond the Smile podcast has been brought to you by our sponsor and partner, the Benco Dental Family Foundation, the philanthropic division of the Benco Dental Company. Dr. Esther Oluwo is a dedicated general and cosmetic dentist at TLN Family Dental with practices in Houston and Pearland, Texas. Dr. Oluwo is a proud Houston native and lifelong resident. Her parents are immigrants from Nigeria who have called Houston home for almost 40 years. She received her bachelor's degree in biology with a minor in public health from the University of Houston, and then went on to attend Texas A&M College of Dentistry for her doctorate in dental surgery. During her education, she received many accolades and awards for her research in dental materials. She also was the first recipient of the Claude Williams Endowment Scholarship and served on the National Executive Board of the Student National Dental Association. She is an active member of the Academy of General Dentistry, American Dental Association, International Association for Dental Research, and a variety of other local organizations. Dr. Oluwo enjoys giving back to her community by mentoring the next generation of healthcare professionals and providing services and outreach missions. I can't wait for you to be inspired and learn from her story and her journey. So let's huddle up. Welcome to another episode of Beyond the Smile. I am your host, Dr. Layla Haishaw, the founder of Diversity in Dentistry Mentorship. This is our podcast, what we call a huddle, where we are bringing together successful dentists of color with our mentees so they can get the game plan to be successful on their journey to dentistry and beyond. So I'm so excited to introduce you to my friend and colleague, Dr. Esther Oluwo. Welcome to the podcast.
Thank you for having me, and so happy to be here.
Oh, that's great. Well, you're a general dentist in Texas, and I would love for you to kind of share a little bit about your story, your journey to dentistry. We'll talk about any any hurdles that you had to overcome, some barriers, but definitely how you came out on top, and to just inspire, encourage our mentees along the way. So, yes, please, let's just start off by sharing how your journey. How did you wanted to go become a dentist?
Yes, so as I was saying, I decided I wanted to be a dentist in the ninth grade. So in Houston, we have high school. It's called High School for Health Professions, and it's an amazing program where it allows students from all over the city to be exposed to the healthcare profession. So it's a school that you have to kind of test in and get accepted to. I grew up in an area that didn't have the best schools. My parents were immigrants, so we just kind of grew up not the best part of town. So my mom was like, "No, you're not gonna go to school around here. We're gonna apply to this school that's supposedly really good." I wasn't interested in healthcare, so I was like, "I don't want to go there. It's like a whole bunch of nerds at that school." But
Yeah.
if you know immigrant parents, they're like not having it. So I applied, I got in, and my teacher, my first teacher in ninth grade, if she's ever watches this, um, Dr. Dupree, she
Oh.
was a female Black dentist, and I loved her as a teacher, and so she really inspired me. And I actually got to have another teacher that was a dentist, and we had teachers that were nurses, pharmacists. We had that exposure in high school. So you kind of get to, that school is really cool because you kind of got the opportunity to see all different kind of health professions. So going into my junior year, they allowed you to shadow in the hospital. and I chose to go in the clinic with the ENT and OMFS. So, and then I was just like, I love this. I didn't think I could be in the hospital. I was like, people are sick and dying, but it's miles. So I was
Oh,
just
yeah.
getting it from there. So that's what kind of inspired my journey. And I got really good advice and mentorship because I was in that environment
Mhm.
to know what to do going into college.
Right,
So
right.
yeah, I kind of had a weird journey when I was going to college because I knew I wanted to be a dentist, but I was just like, okay, how do I get there? How do I get to dental school? And I researched and I learned that, okay, you have to get a bachelor's degree first.
Mhm.
And all this research, I went based on, Googling and, people from my school that were mentors to me. And I was just like, okay, let me be a dental hygienist. That was my initial. I was like, okay, I got to get a degree in something. Let me go to dental hygiene school.
Uh-huh.
So my thought was apply to dental hygiene school. And then whenever I started doing I took the prerequisites for that. And then I was about to apply that route. And then I realized that after I would complete dental hygiene school, I would still have to take more prerequisites for dental school.
Right,
So
yeah, yeah.
that's not the quickest way to dental school. So that's how I landed on making my degree biology
Mhm.
because I was like, that's the quickest way for me to get to dental school. And that'll take care of all my prerequisites. So if anybody's watching this and you're trying to decide on a major and you're undecided, my first advice to you is you can major in anything to get into dental school, but just
Right.
be wary that there are extra prerequisites, whatever degree you choose, that you'll have to take to get into dental school. If you choose a major in the sciences, that would encompass most of your prerequisites.
Mhm.
However, I know dental schools accept anyone from any degree or major as long as you fulfill your prerequisite requirements. So I thought
Yeah.
I was taking the easy route, but biology very hard.
You thought biology was the easy route?
It wasn't. That degree
It
was
was?
very hard.
Very
Um,
difficult. Mhm.
it was lots of studying, but I feel like it prepared me for dental school.
Yeah, yeah.
Um, so I
But I
wanted to
wanted
get.
to touch on, when you were mentioning, deciding on going to hygiene. I know when we had our summit, a lot of times when there's no one there to kind of guide you, and like you
Mhm.
said, you're Googling and searching, and that's what we're trying to do to be able to with our mentorship. So you're not kind of on your own on this journey to have someone kind of guide you along. Someone thought that the sequence was that you had to become a dental hygienist first. Well, actually, thought the sequence was you had to be dental assistant, then you go to hygiene school, and then you can apply to dental school. And so that is just kind of the goal that we're trying to get out there to share the information. Because one, applying to dental school is not cheap. and in stepping back, your undergraduate degree, that's a financial burden too. So knowing
Yeah.
early on and getting on the right track can actually help you to succeed in that. You're not spending so much money and then deciding to kind of change course and start over again. But I love
Yeah.
that high school. Is it still there in Houston? Is it still offering that program?
Yeah, so the Houston was the hygiene school that I was considering applying to.
Hmm.
Um, and it's still active. There's still a great hygiene program,
Yeah.
but I
No,
learned
I can.
that hygiene
Yeah.
school, people who want to be hygienists. So I realized I'd be taking a spot of somebody, that actually wanted to be a
Wanted to do
hygienist.
right. Yeah.
And
And
so,
definitely with the data, I mean, hygienists are have underrepresentation with Black, Latinx, Native
mm,
American hygienists as well. So we need to really increase the workforce all around in dentistry and oral health.
yes, ma'am.
So
So
now you're practicing.
excuse me?
Now you're practicing in
Yes,
Houston.
yes.
Yeah. How what do you love about practice? Is there a certain part of dentistry that you love doing more, or is it everything you wanted to that you were hoping for?
Yeah, so I'm a general dentist, so I pretty much do everything.
Mm-hmm.
Um, I do extraction, surgery, dentures, crown, bridges, implants, Invisalign,
Great.
veneers. So I see children all the way from 1 years old to geriatric patients that are 99 years old. So,
Oh,
you
wow.
know,
That is
yeah,
great. That's a lot to know. I mean, so you went to Texas A&M for dental school, correct?
yeah.
Yeah, and
Hmm.
that was one of the top dental schools, so it really definitely have prepared you. Did you know that, did you want to, when you were in dental school, were you exploring about considering specializing, or that you just loved all the disciplines and you were like, this is what I want to do it all?
Yeah, so I did think about specializing when I was in dental school. I shadowed a lot of the specialty programs whenever I got free time or my patient counseled and clinic hours,
Mm-hmm.
just to see if there was something that really piqued my interest. I
Mm-hmm.
did research with endodontic materials, and that was interesting. I loved the perio department. I loved pros. If I
Great.
had to really choose a specialty, it would have been pros actually.
Mm-hmm.
Um, so then when I realized, I was just like, I just like everything. I like everything about dentistry. I cannot choose, one thing. So I decided I wanted to be a general dentist. From there, I just couldn't choose. And I learned that specializing for people that want, they love one thing and they want to
Mm-hmm.
focus on that one thing. And I just could not decide on one thing to focus on. I was just like, I want to be able to do a little bit of everything. So that's why I
Yeah.
chose.
I think that's great. And with those considering dentistry and coming in thinking that they just want to be orthodontist or just a pediatric dentist, you're just really not giving yourself just that space to really explore everything, because dentistry there's so many things you can do. And when you're, proficient in all those disciplines, it makes the variety of the day so exciting. You don't get as tired doing one thing over and over again. A lot of our mentees and those that are even younger, like in high school, that are finding us on YouTube and wanting to explore dentistry and deciding if this is the right path for them. Can you share a little bit more about your experience in dental school? Were there any challenges? We know that right now in the dental workforce, there's only 3.8% of Black dentists who represent the entire number of dentists in the United States. And so a lot of times in dental school, you're one of just a few in the class. What was the experience like for you?
Yes. So when I was applying to dental school, I only applied to the Texas schools, and it
Hmm.
was really a financial thing. I was like, which school is the cheapest for me to go to? So I applied to all the Texas schools, and I applied to Meharry and Howard. Those are the
Hmm.
only schools outside Texas I applied to.
Hmm.
Whenever I went to one of my interviews in Texas, I realized I was the only one there, meaning
Oh,
person of color in my
right.
interview. And I walked around the school and there was still no one there.
Mhm.
And I actually ran into a resident that was an African American female. And I was just like, hey, how's your experience here? And she was just like, yes, I'm the only one in my program. And so I kind of knew to myself, I did not want to be isolated like that.
Mhm.
Um,
Mhm.
so I ended up choosing the school that I went to mainly because I got the great opportunity to go to a summer pre-dental enrichment program for minority students
Oh,
that
great.
is
The,
held at Texas A&M College of Dentistry every
mhm.
summer. That was way back in, I want to say 2012
When
that
you
I
were
went.
an undergrad, right?
I did it
Yeah.
my senior year, my summer before applying to dental school.
Was
And it
this
was a
the SHIPEP program? Sorry to interrupt. Was this the SHIPEP program? Summer
yeah,
Health Profession?
yes.
Oh, great. Yeah, let's talk about that too. Yeah, I really recommend that for all mentees.
Yes. So they have a summer predental enrichment program, which I was fortunate, so fortunate to be a part of. Anyone that's considering Texas A&M of Dentistry that's a minority, they should really look into that program because you really get to see the school and be a part of it. You get to be on campus, mingle with the dental students, mingle with the staff. You actually get hands-on. You get to wax up things. I got to make a gold crown.
Wow.
I did all of that during the summer. I was studying for the DAT, so they had us in classes like we were in dental school, but our classes were mainly DAT prep, but we did have like introduction to dental anatomy and some clinical aspects in that summer program. So that program really had only minority students or students from disadvantaged backgrounds or from a rural area. So they garnered that program just to reach out to those students. We also had in that program people that were taking classes with us that would take a part of the post-bac. So they also offer a post-bac for the same demographic of students. And that is where they apply, and maybe they didn't get into dental school, but they have an opportunity to take upper level science courses and take their DAT. And if they score well and have a certain GPA in those upper level courses, they would be admitted into dental school the next year.
Oh, that is great. Yeah.
So they had those two programs going on. I did the summer program, but they also had post-bac students together. We're all taking the DAT prep. And at the end of the summer, we took the DAT. Everyone that was in that cohort took the DAT at the end of the summer. So at the time, I didn't have any money to pay for the DAT. So I was just, I have to study this summer in this program, and I have to take it, and I have to take it one time because I don't know where I'm going to get the money to take it again. And they
talk about motivating you. That will motivate someone, right?
And they paid for us to take it at the end of the summer. So I really wanted to take advantage of that opportunity, and I took it, and I did well. Now, from that program, I want to say in my class, my D1 class, there were 16 African-American students. And that is a large amount for a school that's not a predominantly like a HBCU. I feel out of any, other programs, that was a lot for my class. And I want to say 9 out of the 16 either did that summer program or post-bac. So when I saw those efforts that the school was making to increase diversity, I knew I wanted to be at that school.
Oh, I'm so happy that you did that, and I'm glad you are there. And I do see Texas A&M is really setting the bar high. One of my mentees is a D1 there now, and they have over 20 students of color, specifically Black students. So it's amazing that we can see that it is happening. They're finding strong candidates to fit that. And of course, what we're trying to do is get more applicants of diverse backgrounds to even apply, so that they have an increased pool. But I'm so glad you highlighted that, because one of the biggest barriers with the DAT is just the cost of it. Not only just to pay for it, but then there's preparing for it, like the DAT resources and all the stuff from the boot camps to the DAT destroyer. Those things cost. So the fact that you're covering that helps kind of eliminate that one barrier, so everyone has a chance to succeed. And I should mention too, I just learned recently that the American Dental Association offers a practice test for $100, a DAT practice test. And they have high success, showing that the scores are pretty elevated from those who take it. So just something out there for everyone who's listening. So Texas A&M, very supportive. Were there anything that was challenging that you can share, like how to prepare themselves, that you want to share?
So although there were faculty that like Dr. Lacey, she was the one that oversaw those programs that she's now, I believe, the Dean of Students at Texas A&M. So I'm so proud of her.
Oh, great. Yeah.
But she ran those programs that got myself and others the opportunity to be seen and have the opportunity to take the DAT and do well. So when I got there, there was staff and faculty like that that were there for us to lean on. And then, of course, there was SNDA. I was part of the Student National Dental Association. So I started in as a D1 just because I met some upperclassmen when I was in that summer program, and they already kind of recruited me and said, okay, when you start as a D1, you're going to be an SNDA. And I'm so happy I found that organization. I became so involved. And I
Sure.
became
I mean, I know a lot of people know, but some people don't know what SNDA is. Can you tell us a little
okay.
bit more, the component
So,
of the NDA?
yeah, SNDA is Student National Dental Association, and it's the organization for African American students in undergraduate or dental school.
Mm-hmm.
And it is the dental school version of the National Dental Association. So people are in Student National Dental Association, they graduate and they filter into the National Dental Association. So we had a lot of mentorship from dentists that were part of the National Dental Association. They supported a lot of our initiatives and events.
Mm-hmm.
Um, and I became really involved with that in dental school. That was something that was like helped me throughout all 4 years. If I didn't have those group of people and I didn't have that network, whether that be from the faculty, staff that was supporting us in the school, and those dentists that were outside of the school that were in the
Mm-hmm.
NDA that supported us, that was my network that kind of got me through. Because despite despite having that support, there was a
Yeah.
lot of
Yeah.
we a lot of intimidation from other students and other faculty, microaggressions,
Yeah.
because some people don't know what they're saying or doing could be offensive,
Mm-hmm.
but they say it and they do it, and you realize that you're also in the school with people that maybe never had a class or
Mm-hmm.
friends that are, of other race, so they don't know how to speak or act around them.
Yeah.
I also was in school during the time where Donald Trump was first getting elected, and there was Trayvon Martin, and a lot of things were
Mm-hmm.
going out socially. So a lot of people started showing their true colors,
Yeah. Yeah.
and that was the whole time I was in dental school. So there was a lot going on socially during that time.
Mm-hmm.
I don't even want to particularly mention some of the specific instances that I went through.
Right.
But because I said, like, because I had that family, that friendship in SNDA, I think that's what helped me get through.
Yeah, I can imagine. I totally respect that. And I can just, dental school's already hard enough. And then when you have that on top of you, the microaggressions, and that's why I think it's so important now that schools teach on unconscious biases. I mean, I know there's overt racism that happens and systemic racism, but the fact that a lot of these dental students and your peers who have these unconscious biases, it does affect the equity of care, how they're recommending treatment plan. They have this confirmation bias is what they think, and so will dictate who's gets to recommend saving the tooth versus extracting the tooth. There's a research paper on that too that shows that um, with everything being constant with the report of the tooth, it's an irreversible pulpitis, meaning the decay got into the nerve, so you could either save it with the root canal or you extract the tooth, but something has to be done. But everything was the same: the X-ray, the oral intraoral pictures, everything except for one was a black patient or the white patient. And the survey showed that most dentists would recommend extracting the tooth for the black patient and saving the tooth for the white patient. So, I mean, that's just one small study, but this happens, it's compounded over and over again. So I digress. I was just mentioning that I
Yeah.
know it's happening, and that's why it's important for schools to educate.
Yeah, I totally agree. I remember I was in my pediatric dental course one year, And one of my professors, who was also was a great mentor to me when I was in dental school,
Mm-hmm.
was one of the mentors for SNDA. He was our faculty, and he asked. We were just like in a group. We were having like a group discussion, and he asked. He was like, "How many of you are going to see Medicaid when you graduate?" And it was probably myself and two other students, like out of like a group of 14
Mm-hmm.
that raised their hand. And if you looked around,
Mm-hmm.
the two other students were minority
Yeah.
students
Right,
and
right, right.
nobody else. And then so my professor asked, he was like, why wouldn't you see Medicaid? And then someone mentioned, oh, they don't care, they don't show up to their appointments, or
Mm-hmm.
um, they don't, invest in their teeth, and
Yeah.
it's doesn't pay enough, or so on and so forth. People had a lot of excuses, and that kind of stuck to me that day in class, and I just knew there needs to be, I know it's not something that pays well, but
Mm-hmm.
somebody has to care for those patients who don't have that access, who
Mm-hmm.
maybe financially or whatever that means. And there's a lot people that are on Medicaid, for example. I see a lot of Medicaid patients. It's not because they don't care. Sometimes they need to be educated so that they can
Mm-hmm.
prioritize their dental health. And once they are educated and realize that their teeth are connected to their body and it affects their
Mm-hmm.
whole health, they start to prioritize it. Um, sometimes it's a financial hurdle.
Yeah.
Sometimes it's taken. Not everybody can take off of work on a Tuesday to get their teeth fixed, or take off of work to take their children to get their teeth fixed. Um, that is another hurdle. Some people don't have transportation. I have a lot of patients that take Metro or
Mm-hmm.
Metro Lift, just to get to their appointments. Some people just don't have that luxury and to be at their appointments and on time. And we have to be able to empathize. And
Mm-hmm.
I feel like I somewhat empathize because my mom was one of those patients.
Mm-hmm.
And I remember going to one of my dental appointments, and I remember the front desk was like, same day schedule only to my mom. Like, you cannot make an appointment. And
What?
because it was because my mom always was late to every appointment. And it's
Uh-huh.
because
She had to
to
take.
get a ride, because she couldn't get off of work. She was working and she had to find somebody to take us. I remember one time she got a yellow cab to drop us at our dentist appointment.
Mhm.
So it's not that easy for some people, but people don't see who that person is before they walk through the door. And
Mm.
it takes a certain level of provider to be able to provide compassionate care, because they understand where those demographic of people are coming from.
Yeah, thank you so much for sharing that. I mean, there's so many stories like that. And when we speak of like social determinants of health, that these dental students need to really understand that's kind of where we work, live, and play kind of affects our overall wellness because of transportation, like you were talking about, educational resources, um, food like groceries. Sometimes they'll think, oh, well, I'm not going to go over oral hygiene instructions because they're just going to eat those flaming hot Cheetos and chips and soda pop. And, I can't change that. But maybe they're in an area where we have a food desert or even a food swamp. Food swamps now is being described as not only are there no fruits and vegetables available for people to purchase, but it's like just more of the junk food, and so that does affect their health. So
Yeah.
you nailed it when you said we need more compassionate providers. And I think it's incumbent on all the dental schools to really looking at holistic admissions, and just instead of just looking at GPA and DAT scores, like what have they done in service to different communities? Where are they from? Who's actually going to be more likely to serve in those communities that are in need to increase access to care. So I'm glad you're doing it.
Yeah.
Yeah.
And I love when my patients come in and they see me. I'm so fortunate to work at a practice where it's female Black owned,
Mm-hmm. Yeah.
and all the associates are also Black females. So we see a lot of patients that come from all over because they're like, I want a Black dentist,
Right.
and
Yeah.
they find, and we also have patients that sit in our chair and like, wow, I've never seen a Black female dentist before.
Mm-hmm.
And that just makes me really proud because I didn't realize how much of my minority it is that patients are literally shocked. And
Mm-hmm.
I hope one day it's not something that is a unicorn or so shocking. So shout out to Dr. Nickelberry, who's, founded the practice that I'm working at,
Oh,
and building that environment and going against those, statistics, because we're able to provide exceptional care to our patients.
yeah. And do you know how many patients, your young patients, you're inspiring to
Mm-hmm,
become a dentist because they see them and you?
mm-hmm,
And it's like, wow, they're going to be here 20 years later saying, oh, I was so inspired by Dr. Oluwo. She was my
yeah,
dentist.
yeah,
Yeah, and I tell my colleagues and dentists, even those who are all of them, not just dentists of color, that you have a captive audience in your chair if you're seeing kids. So just kind of when you see them, plant that seed of hope and let them know that they too can do it, and just consider. Because if you weren't in the school that you were, a lot of students, no one really talks about dentistry as a career
yes,
choice.
yeah.
Yeah.
I don't think I would have considered it if I wasn't exposed to it.
Hmm.
And yes, being a dentist is hard. It's not easy. Your neck, back hurts all the time.
I know, I was doing this earlier.
And
Stretching.
you're with a lot of people who are in pain. At least in my situation, I deal with a lot of patients that come in when it's already, they're in pain, or it's everything is going south and we have to rehabilitate them again and teach them how to take care of the teeth again.
Yeah.
Um, and you deal with patients that have fear and anxiety because maybe they had a provider that wasn't caring or compassionate. And I have so many patients that say, oh, I told my last doctor I was in pain and they didn't believe me. Or,
Mm.
I told them, they're missing a lot of teeth. And they were like, well, nobody ever told me I could save this tooth,
Mhm. Yeah.
so on and so forth. So we do get a lot of patients from all different walks of life. And it's very important that, we educate them and, of course, provide them with really great care.
Yeah, yeah. We're more than dentists just fix teeth. We're teachers
Mhm.
and role models, educators, and you're doing all of that. I can't believe our conversation is already coming towards the end, but I wanted to see, we have one of our mentees online. If we have any questions, you can put in the chat. But if anything, as that's happening, I was going to just ask. I mean, you shared a lot of gems. If there is anything specific about preparing for dental school or how they can increase their chances to be successful, what would you share to a young mentee?
So first of all, it's the really black and white thing is you don't want to put yourself in a situation where it's harder for you to get in. So
Mm,
of course you're going to hear this everywhere and make good grades and do well on the DAT. That's number one. You don't want to be racing at the end trying to um, make your application have other things in your application or trying to get your grades better at the end. If you make a mistake, it's okay. If you made bad grades, it's okay. You can get ahead of that. You can overcome that. But
mm,
really when you're in college, try your best to focus. I know, partying and, friends, things can be distracted. But if you know early on that you want to go to dental school, um, making good grades is really important. I do recommend shadowing, of
mhm,
course. That way, for sure you wanna go to dental school. I had a friend I started shadowing with freshman year of college, and by the end of the summer, she was like, "Nope, don't want to do this." And
Oh,
so,
yeah, right.
yeah, and, and we both thought we were going to go to dental school at the end. So you don't want to, spend all that time and investing, and then you realize it's not for you. So shadowing is not just something to put on your application. It's something that really opens your eyes and lets you know what a day in the life of the dentist is.
That's such a
Um,
great point. Thank you. Yeah. Mhm.
and I would say doing your research on the programs that you're wanting to get into. I know sometimes we cast a big net and we don't know what school, but we're just trying to get into any school that, will accept us. But because I knew first I wanted to go to Texas A&M, I was just Googling summer pre-dental programs I had no idea they had a summer program, but I just
Wow.
knew that was one of the schools I was going to apply to, but I wanted to apply to Texas schools. And I did my research on the school and found out they had that program, and that
Mhm.
UT had the SMDEP program. Unfortunately, by the time I learned, I was already a junior,
Yeah.
and I missed the opportunity to go to SMDEP. Um,
Mhm.
but knowing the schools and their programs, because you don't know the school in your state or in your city has summer programs, has an impressions day, has a
Yeah.
post-bac program. And if you know about those programs, I feel like that definitely gave me an advantage to get in, because I got to meet faculty and staff, like two people that interviewed me. I met them that summer. So I was so
Oh, yeah.
on my interview. I was just like, "Hey, doctor, remember me?" And so,
Yeah. Oh,
uh,
so true. Mhm.
yeah, that helped a lot. Asking questions, if you're not sure, um, definitely having a mentor too, somebody
Yeah.
you can ask those questions to.
I love that. I love that what you shared about, of course, the mentoring. We feel strongly that's just the heart of it. But the shadowing is so, so, so important, because you're right. You don't want to spend all that money, all that time investing, and then realize this isn't for you. As your mentor, we're always just going to want you to succeed in whatever it is that is your dream, your desire. If it's dentistry, great. But we want to make sure that it is for you. And any summer program, I've spoken to faculty who are on the admissions committee, and for sure, I know they're fighting for those students that they know from those summer programs. But you brought up something that hasn't been stressed so much, but it's those impression days. Like pretty much all dental schools, SNDA or and HDA that hosts those programs. That is a great way to get in and also meet some faculty as well. And I believe summer now, I know if we're going to find if there's anything good out of the pandemic, a lot of things went virtual. So some impression days is a hybrid where you can join in virtually as well. So great advice, great advice.
You get to see the campus, you get to look at the students, look at the classrooms. That's the whole point, is for the school to make an impression on you. So going to those things not only lets you know if you want to even apply to that school, if it's somewhere you could see yourself
Mhm.
thriving and surviving, literally
Mm.
surviving for
Yeah,
4 years.
right.
So it's a big investment, and you don't want your 4 years. It's already hard enough. You don't want to be
Mhm.
miserable and depressed. You want to be somewhere where you feel comfortable, or at least you can find friends and fellowship in,
Mhm.
and mentorship in. So
Yeah. Well, that's great. Well, I'm so glad that you did it and you're here to share your journey just to inspire and empower the next generation of diverse leaders. Thank you so much for your time. If anyone had questions or wanted to reach out to you, is there social media or any sites you want to share for us?
yes, you can follow me at Dr. Esther O.
Hmm.
Um,
Hmm.
and anybody who's interested in shadowing, like I said, we are a Black-owned practice. All of the doctors would love to be mentors to any of you if you're in the Houston, Texas area. And even if you don't want to shadow me, I know so many in the city that would love to, be a light to you. So you can send me a DM or a
Oh,
message.
great.
out to me. I love to mentor. So yeah.
Oh, I appreciate that. We all appreciate it so much. And that's a key thing about mentorship is that we're sharing our network with you. So maybe they're not in the Houston area, but they reach out and say, do you know anyone in the, Atlanta area? So that's very exciting. I'm so excited for you. I wish you continued success,
Thank
and
you.
the lives you're touching.
And thank you so much for what you're doing. It's amazing. I'm inspired and in awe of you. So thank you so much for what you do.
Well, can't do it alone. It takes a village. So I really appreciate those words. And it just helps us to keep going and know there's just such a need out there. So together we'll make that needle kind of tick on over to increase that statistic. So we're not seeing it for another 20 years. But with dentists like you, colleagues like you, I'm very grateful because we can let them know that if we did it, so can they. Thank you guys so much. Please make sure to share this episode. If it resonated with you, you can share it, just like it and share it with a classmate, colleague, so that we can continue to get the message out. And I hope you guys all have a wonderful evening, and we'll see you on the next episode of Beyond the Smile. Thank you so much.
Bye. Thank you.
Thank you for joining us on another episode of Beyond the Smile. If you need a dental mentor, or you would like to be a mentor, or even if you would like to support our mission to strengthen the diversity pathway from middle school to dental school, please visit our website for more information at diversityindentistry.org. Please share this episode, subscribe to our podcast, and together we can raise the next generation of diverse leaders in dentistry. We did it, so can you.